Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way, it's just one that has worked extremely well for me, and I'd love to share that with you so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast.
I don't want to throw another dentist under the bus, but what I do want to do is I want Bob to understand that he's the problem. He's the one not brushing. He's the one that doesn't floss. He's the one that doesn't wear an occlusal guard. He's the one that doesn't show up for his appointments for cleanings. He's the one, all of these things. It's not our fault. And that's one of the things I love. That's communication. Hi, my name is Dr. Bruce Baird with the Productive Dentist Podcast. And thanks for joining us today. And I am excited to talk about something that has been, I think, one of the keys with the Productive Dentist Academy over the years, which is increasing productivity and reducing stress by using good communication skills. And, I'll give you some examples. You have that patient come in and they're going to have a crown done, or they're going to have a filling done. And the tooth hasn't been sensitive at all. I kind of joke a lot of times. I always say that I've never seen a shallow filling. Why is that? Because, if you put a burr on a tooth, there's a chance it could be sensitive. And what I decided, I started looking at anything that I talked about this last time, about anything that causes stress to patients, anything that causes stress to team, or anything like that. But the big thing is, for me, to become more productive, is the communication and saying, hey, Bob, if I'm doing a crown on number 8, this is the hardest thing in dentistry, is to match a single tooth. And when you smile, you're like me. You show all the way up, you show your gums. And so when we do that crown, can it be done? Yes. But it's very difficult. And we've got some choices. My preference is to use a lab that is a high-end ceramic lab, or we do it ourselves right here in office. It may cost a little more, but Bob, it has to be perfect. It has to match. Does that make sense? And Bob says, oh yeah, I want the best up there because it's right in front. And so cost goes to the back of the line. Because why? Well, because the patient understands now that this is hard, as opposed to me going in 25, 30 years ago, and a patient comes in and says, hey, doc, can you fix my front tooth? And I go, oh, sure, don't worry, sit down, we're going to have fun. It's not going to hurt. We'll go slow and easy. And then you get the crown back, and let's say you did everything right, that injection didn't hurt, and all the things that you did were at the highest level you could do it. But you forgot to communicate the difficulty. Okay. And so you try it in, you put the thing in. I know you guys have never done this, but you put that crown in, you go, oh, okay, well, this is a tough one because it doesn't match the way it has to match. Okay. So I'm going to send it back to the lab with another shade tab, and I'm going to do that. Okay, Bob. And Bob says, oh, okay. So you send it back to the lab, and then they send it back, and you look at it one more time and you say, Bob, this is so hard. I'm going to send you to see my lab. And so you send the patient to the lab, and the lab does does their shade matching and everything else. And then it comes back, and you look at it and you're going, okay, it's good. Is it perfect? That's when you bring your team in and everybody goes, oh, doesn't that look good, Bob? Oh yeah. And he's like, yeah, they look great, but they're not perfect. It's not exactly what we need. So I looked at the ability to be able to custom stain and do those things. For instance, using CERAMP, but there's so many new technologies out there right now. But I wanted to learn how to stain a front tooth. So I took the classes. I learned how to do that. So I could take any colored tooth and make it match. And so remember Bob getting that crown, and by the fourth visit, Bob's looking at you like, you don't have a clue what you're doing, doc. And that is stressful. Productivity goes down. We're not producing at the highest level because we did not tell the patient about the difficulty. And so now I told him this is very difficult. It may take us about 3 or 4 or even 5 visits. But I want you to understand that ahead of time. But it has to be perfect. Does that make sense? Bob, every patient I ever said that to, they go, oh yeah, okay. It's going to take 5 visits. Then when I learned to custom stain, and I would bring the patient in, we'd mill the tooth, I'd put it on, and maybe the base color wasn't right yet. I'd mill another color that was good, but then I would go in and start to custom stain it. I would put it in, and then Bob and I would look at it together and say, what do you think? He goes, man, that looks perfect. 1 visit, maybe 2, but 1 visit. Now, what is Bob's thought process of our office, of me at that point? Well, I would say his thought process is this guy knows what he's doing. I mean, he really does. As opposed to, I knew what I was doing before. I just didn't communicate it. I just didn't communicate it well. It's the same with that filling. Doc, that thing didn't hurt before you worked on it. Do you guys ever hear that? I mean, that is a buzzkill. Okay. That's a buzzkill for the day. What happens to productivity? It goes down. Why? Because we didn't communicate. I would say, Bob, we got to do a filling down here. It's on this bottom right tooth. Say it's number 29. It's a bicuspid. I'm going in with a fissurotomy burr, and I'm opening up the occlusal pits, and I'm looking at it, and I'm going, wow, Bob, there's a lot more decay in here than I thought. I thought it was, I thought it wasn't going to be quite this big. We're going to have to keep an eye on this one for sensitivity and for, and to make sure it's okay. I don't think you're going to need a root canal, but let's keep a watch on it. And I want to see you in 2 weeks. But if you have a problem, I want you to call me. You see the guy in 2 weeks, comes in, Bob goes, hey, doc, that tooth never hurt me at all. So what's he thinking about you? Oh, you're the best dentist there is. Didn't hurt at all when I said it could hurt. Does this make sense? Because it's not. Now, if I said nothing, if I just said, oh, yeah, it's a little filling, we'll get it done, do it. And all of a sudden, the patient, not that it happens often, but when it happens, it's a buzzkill. And he goes, this tooth wasn't hurting before. Now it's sensitive. They go down and they're at the bar or they're at the club or they're at church or they're getting their hair cut and they're talking to people around them and they're just saying, yeah, I got this sensitivity. Every time I drink something cold, it's just so sensitive. And the tooth wasn't hurting before. Where'd you go? Oh, I went and saw that there. I don't want that. I don't want people talking like that. I'd rather just tell them this is a lot deeper than I thought, which I can honestly say, I don't think I've ever gone into a tooth that the decay was less than I thought. And by just talking to that patient and explaining to them, educating them on the difficulties, then all of a sudden, you're a great dentist. Everything's great. Your attitude is phenomenal. We already talked last time about communications with your team, getting everybody on the same page with clinical calibration. But your team hears what you say to the patients, and they're going to say it to the patients, which, to be honest with you, is just crazy good. It helps in every aspect of being a dentist. What about that patient who goes to the front desk and they don't have firm financial arrangements? They just walk up front and the front desk says, well, your total today is going to be $1,300. They go, how much? Now, when they say how much, something has fallen apart. The system has broken in your own office because they should know that. And we have them sign, we go through and we show them everything and we talk to them about it. But my chair side, my treatment coordinator, is the one who's in charge of that chair and in charge of making sure that patient understands exactly what the costs entail. Another thing that's a problem is when patients don't show. Why do patients not show up for their appointments? What do you think? Usually it's a lack of clarity. It's a lack of, they don't really know what you're doing, or they can't afford it. They said, yes, I'm going to set the appointment up, but they really can't afford it. And that's where communication is noticing how somebody looks, how they speak, how they nod their head. Oh, yeah, I totally understand. Everything's good. Let's get her done. I want that patient to be 100% sure this is the type treatment that they're having done, so they know exactly what it is, so that they know exactly what it's going to cost. And the financial arrangements have been made solid so that, and they're convinced that, yes, this is what I need to.
Doctor, are you tired of repeating yourself with your team over and over again, and yet you still see treatment walk out the door? If so, you're not alone. The Clinical Calibration Institute, powered by Productive Dentist Academy, is an all-new online platform that unites your team around your philosophy of care, so patients can say yes with confidence and you grow with purpose. Including online curriculum with world-class faculty, monthly live mastermind sessions for each department within your practice, and an online private community, this is your home to grow. Head over to clinicalcalibration.com today to join every member of your team for one very low monthly membership fee. That's clinicalcalibration.com.
The bad thing is when they go, it's going to be a total of $2,200 or $3,000 or whatever it is. And the patient goes, oh, okay, yep, let's go ahead and set up an appointment. But nobody has asked them any questions. No one has said, do you want to pay that all cash up front? Well, yeah, let me think about it. Well, think about it. They ain't showing up. Or let me talk to my spouse. Well, that means they're not showing up. What if we go through the deals and said, I don't need financing, doc. I got the cash. I'm ready to go. Let's do it. Okay. It's how they communicate with us and how we communicate with them. My team, every single one of our treatment coordinators in our entire office, they know how to communicate. And how'd they know? Because they've learned it over a period of time, because they don't like having their patients not show up. They don't want Bob not to show up for his appointment. And I always look back and I say, okay, what did we do if Bob doesn't show up? Which is so rare in our offices to have patients not show up for their appointments. And so that would be, that's unusual. And I would always go back and look, where did the ball get dropped? Let me see the financial arrangement sheet. Let me see this. Let me see that. When they didn't show up, sometimes there was no financial arrangement sheet. The patient just said, oh, don't worry about it. I'm going to pay cash. But yet patient didn't sign anything. Patient wasn't in total understanding, or possibly they had the money, but your exam process was very blah. You didn't go through the risk factors. The patient did not understand that the risk factors are the reason that they're having decay issues, that they're having periodontal issues, that they're having functional bite issues. So by explaining those things, by getting those things taken care of with the explanation, and I would expect to hear every time, like I said last time, I said, that patient says, wow, that's the best exam I've ever had. Why hasn't any other doctor ever done this? Well, I don't know. We keep learning things, Bob. We're learning every week. I don't want to throw another dentist under the bus, but what I do want to do is I want Bob to understand that he's the problem. He's the one not brushing. He's the one that doesn't floss. He's the one that doesn't wear an occlusal guard. He's the one that doesn't show up for his appointments for cleanings. He's the one, all of these things. It's not our fault. And that's one of the things I love. That's communication. I want them to 100% understand I am your consultant. I'm the guy I want you to trust me, because it's not about the money. If I can talk to a patient just straight up and explain in 5 minutes, 10 minutes about the risk factors, this is the things that I look at. I look at the same things on everybody, Bob. I always look at the gums first, and we go through that process. What other things? A dental implant. Do implants fail? Well, if you've done enough of them, you've had an implant failure. I've heard people say, oh, I've never had a failure. We haven't done very many. Or you're moving every 6 months, because, I would tell a patient ahead of time. I would say, Bob, let's use Mary. I'm picking on Bob a lot, but Mary, the deal is, you're a perfect candidate for an implant. And let me tell you about implants. It's going to be fairly simple. Remember when that tooth was extracted? Well, I'm like, oh, it was horrible. It was so hard, which I don't want my extractions to be horrible or hard. That's why I love sedation and I love, I love having them knocked out. But remember, how was that experience? Oh, gosh, it was horrible. So let me tell you something. Putting the implant in is going to be one of the simplest things we do. Not expecting you to swell. You could get a little swelling. You could have a little pain, but usually patients take a couple of ibuprofen, Tylenol. I'm going to give you some pain meds just in case, but most patients don't even need them. And it's going to take me probably 10 minutes to put it in. Now, that sounds good, doesn't it? Yeah, it sounds great. But about 1 out of 20 of these, the bone doesn't grow to the implant. Now, I don't need to get into osseointegration and bone morphogenic proteins and all the things that I don't want them to glass over. But the simple conversation of, 1 in 20, they just don't work. Your bone doesn't grow to it. I said, but the good news is when it doesn't, we usually can clean that out, put another implant in, and then it works fine. Because how many times have you done a second implant and it failed? Now, that has happened to me. I put in probably 18 to 20,000 implants over 40 years. So it has happened. But most of the time, the patient will come in and go, how's it doing, doc? It feels okay. It's not hurting, everything. Is the bone growing to us? Let me look, man, you're healing great. Another thing I do is following protocol. Did you take your antibiotics? Did you do, did you go through? Are you using, rinses? Are you, what have you done? But ultimately, that is how patients, it's not just, how do you build trust? Communication. How do you build relationships? Communication. Communication, does it lead to productivity? Absolutely, all day long, every day. I always used to say, if I get in a relationship with the patient, then money always takes care of itself. And I honestly, truthfully believe that. I never worry about money. I just worry about making sure the patient understands what it is that we're doing. Now, I don't want you to over-explain. I don't want you to take a person who comes in and is nodding their head going, yeah, doc, let's do it. I'm ready to go. I still want you to go through your risk factors. But what I don't want you to do is then start talking about the surface blast on your implant or the type material you're using. Now, I say type material, I would say this is the best material in the world. That's why we use it. This is the best impression material. This is the best whatever. But I don't want to get into the science unless the patient is an engineer. Then you might have to talk about the molecular structure of titanium, but for the most part, you're not going to have to do that. So do you see where I'm going with this? Do you see that doing dentistry at the highest level is having a patient show up for their appointment, pay for their appointment, and think that you are the best dentist on the planet? Productivity takes care of itself. But if you just walk in, I've had associates just walk in and go, hi, how are you doing? My name's not. In fact, I just went to, my wife had an exam at her physician, and I'd never met the guy, and she hadn't either. It was a new doc, and we went in, and he just walked in and goes, hey, how are you? Turns his back to us and starts asking questions with his back to us. We see that all the time. I've seen it with associate docs that, they just come in, okay, what you got going on? It's like I've got 9 other things I need to be doing. No, it's just me and you. I'm here. My team they already know all this. So they've already prepped them by talking to them about a little bit about risk factors, a little bit about, all the things that they see in the mouth. Are they diagnosing? No. But I want them to know when they look at a tooth, I want them to have a pretty good idea. I mean, a really good idea. Dr. Baird's going to recommend a crown on that. Dr. Baird's going to recommend probably not a crown where you have to whittle the whole tooth down, but something where we're going to make a puzzle piece like it fits in and it looks just like your natural tooth. I may say the same thing when I come in, but what does that tell the patient? Great communication. This team is on top of it. They know exactly where we're headed. And, I can remember back when I first started in dentistry, I was always frustrated because I felt like I was frustrated with my team because I figured they should know what to do because they went to school and training to learn to be a dental assistant, but they didn't learn to be a dental assistant or a treatment coordinator with me. That's when I talked about that couple of podcasts ago. But now I want them to understand. So that's part of this Clinical Calibration Institute. It's getting everyone on the same page. We talked about that. But clinical calibration, to be a founding member is like $540 a month or $450, something like that, $540 a month to train your entire team. Your administrators are all on the same call with other administrators. You've got your treatment coordinators, they're with treatment coordinators. You have your office managers, they're with office managers. You have your associates, they're with other associates. You have the docs, they're with the docs. And so as you develop that standard of care and the type of dentistry you're doing, I think the most important thing you can do is learn the communication skills. Buy the books, go out, look it up now. Just chat GPT. What are the best books for me to read on neuro-linguistic programming, meaning facial expressions, in other words, how people are saying things. Did I do that? You darn right I did. Why? Because I had trouble getting patients to say yes. But once I got it, man, everything changed. Dentistry became so much easier. My stress levels got so much lower. I was able to be massively productive in a much shorter amount of time. So, I hope this has been good. I hope what I'm saying is resonating with you, because the docs who get it become highly productive. But to me, productivity, what is joy? Is it money? Maybe for some. For me, it's, yes, I want to make a great living. I don't want to worry about the money. If I take great care of the patients, I don't have to worry about the money. But I also want to have time to spend with my family. I also want to have time to spend with my buds. I also want to have time to play golf. So I can't do that if I don't have the communication skills to maximize the effect of getting to sit down with a person who needs dentistry and then having them walk out the door and not do it. People always say, well, I need a lot of new patients. Well, no, you don't need a lot of new patients. Pete Dawson told me that years ago. And Pete wrote a foreword in my book I wrote on implants back in 91. But Pete says, no, we don't need a lot of patients. You just need 18 to 20 new patients a month. And back then I'm 32 years old, 33 years old. And I'm going, yeah, Pete, because you see other doctors, you see kings and queens, people come in to see you. You only need 18 of them. I found out later on, no. If you market to the right people, which we'll talk about that coming up, but if you market to the people who need the things you love to do and you learn to communicate, guess what? Bingo, game over. So anyway, this Productive Dentist podcast, please tell your friends and Clinical Calibration Institute. Go to the PDA website, productivedentist.com, sign up for CCI, try it for a few months. It's, get your team, get them excited about something. You don't have to fly to Timbuktu. This is all going to be done like a lot of people like to educate, right here, just what we're doing now. So I look forward to our next podcast. This is Dr. Bruce Baird with Productive Dentist.
Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.